Welcome to video series on acid-base balance. Now this video is on lab report interpretation and discussion. So here is a stepwise assessment of acid-base disorder. The first step is you need to assess the pH. So the normal pH is 7.35 to 7.45. If the pH is less than 7.35, it is acidosis. If the pH is more than 7.45, actually it is alkalosis. Now the next step you need to consider is check the level of serum bicarbonate level. The third one is check for partial pressure of carbon dioxide. Fourth one is check for the compensatory response. The next step is you need to assess the anion gap by estimating the concentration of sodium, chloride, potassium and bicarbonate. So the next step is assess the change in anion gap, whether the anion gap is increased or normal. So the last step is you need to assess the underlying cause. Consider various lab reports for better understanding of the disorders. Now here is a lab report. Here the pH is decreased, so it is acidosis. The bicarbonate is decreased because bicarbonate is a metabolic component, so it is metabolic acidosis. This is because partial pressure of carbon dioxide is normal, so it is not respiratory acidosis, and there is no change in partial pressure of carbon dioxide, so this is a case of uncompensated metabolic acidosis. Let's consider one more report. Here the pH is decreased, bicarbonate is decreased, so it is metabolic acidosis, and the partial pressure of carbon dioxide is also decreased. This is because when the metabolic acidosis is getting compensated, it involves the counter variable, that is partial pressure of carbon dioxide, by decreasing the partial pressure of carbon dioxide. So this is the case of compensated metabolic acidosis. Let's consider one more report. Now here pH is decreased, so it is acidosis. Bicarbonate is decreased and it is a metabolic component, so it is a metabolic acidosis. Because partial pressure of carbon dioxide is normal, so it is not respiratory acidosis. Now check for the anion gap. Anion gap is increased, so this is a case of uncompensated high anion gap metabolic acidosis. Consider one more report. The pH is decreased here, so it is acidosis. Bicarbonate is decreased and it is a metabolic component, and partial pressure of carbon dioxide is normal, so it is a case of metabolic acidosis. Because partial pressure of carbon dioxide, which is a counter variable for compensation, it is normal, so it is uncompensated metabolic acidosis. And consider the anion gap, it is normal, so this is uncompensated normal anion gap metabolic acidosis. Now let's consider this case Vinete. Here is a 17-year-old boy, known case of type 1 diabetes mellitus, who is brought to emergency department in a disoriented state. On examination, patient had small breathing characterized by increased respiratory rate. Series of 2 arterial blood gas analysis were done, which showed the following changes. Now let's interpret the ABG analysis. Now here are the reference range, and this is the first ABG report, which states that pH is 7.2, it is decreased. Next is partial pressure of carbon dioxide, so it is in the normal range. Bicarbonate is decreased, so it is metabolic acidosis. The anion gap is increased, so it is high anion gap metabolic acidosis. Now to check whether it is compensated or uncompensated, partial pressure of carbon dioxide is normal, so it is uncompensated metabolic acidosis. Because anion gap is increased, it is uncompensated high anion gap metabolic acidosis. Now what is the cause for this altered ABG? Now just check out here, the random blood glucose is increased and urine rotheras test is positive. So this is a case of uncompensated high anion gap metabolic acidosis. The cause is diabetic ketoacidosis. Now consider the second ABG report. Here the partial pressure of carbon dioxide is decreased, which states that the patient is going for compensation, because for the metabolic acidosis, the compensatory variable is partial pressure of carbon dioxide, and in metabolic acidosis, bicarbonate is decreased and compensation involves by decreasing the partial pressure of carbon dioxide. So this is a case of, and bicarbonate is also decreased. Now this is a case of compensated high anion gap metabolic acidosis, the cause being same, diabetic ketosis. Let's consider one more case Vinete. Here is a 20-year-old girl who is brought to emergency department in a disoriented state with complaints of severe diarrhea around 12 times. The girl was healthy before the onset of this episode. On examination, there is small breathing. So doctor gets her arterial blood gas analysis done. Let's interpret this. What has happened to pH here? It is decreased, so this is a case of acidosis. Now what has happened to bicarbonate? Now this is decreased, and the partial pressure of carbon dioxide in the first ABG report is normal, so this is uncompensated metabolic acidosis. What has happened to anion gap? It is normal. So this is uncompensated normal anion gap metabolic acidosis due to diarrhea. So let's consider the second ABG report. Here the pH is decreased, bicarbonate is decreased, and partial pressure of carbon dioxide is decreased. This is because for metabolic acidosis, the counter variable is partial pressure of carbon dioxide. In metabolic acidosis, the primary biochemical change is decreased bicarbonate. So the counter variable decreases to compensate this metabolic acidosis. Now this is a case of compensated normal anion gap metabolic acidosis, the cause being severe diarrhea. So this was all about lab report interpretation and case discussion on metabolic acidosis. So the next video will be on lab report interpretation and case discussion on metabolic alkalosis. Thank you for watching. Please do like, share and subscribe.